According to researchers, more than 40% of COVID-19 survivors across the world have or had long COVID. If you wonder what is long COVID and how to overcome it, then this session is for you. Hi, I'm Dr. Sharipova, the host of Rebuild Your Health Summit, and I'm so excited bringing you a wonderful speaker, Dr. Nadia Ali, the founder and director of Functional Holistic Healing. Dr. Ali is board certified in internal and integrative medicine and has a master's degree from Johns Hopkins Bloomberg School of Public Health. She has expertise in Ayurveda, mind-body medicine, functional nutrition, epigenetics, and Chinese medicine. Dr. Ali, we are so grateful and excited to have you with us today.
Thank you. I'm excited to be here with you guys.
Before we talk about long COVID, I would like to ask you, what brought you to functional medicine? As I understand, you were trained in allopathic medicine.
I was trained in allopathic medicine, and I did my residency from Hahnemann University Hospital. And at the end of my training, I actually joined University of Pennsylvania Health System as an academic hospitalist. At that time, I was really interested in health literacy. So health literacy is a concept whereby you want to understand the patient. You know how we have a tendency in conventional medicine of labeling patients as non-compliant. And a lot of times it's not that they're non-compliant, it's just that we have never been able to understand what their goals are. And we're never able to explain to them why we're asking them to do certain things. And that led me to do my master's. However, as when I was doing my master's and I was doing this full-time hospitalist job, I was going through my own health issues. I was really burnt out. I felt like I was getting depressed. And at that time, I was trying to seek help for my own health, and I didn't want to take any medications because, as a physician, you know a lot about the side effects, how these medications affect your health, the long-term issues. And I was like, I really can't do this. So at that point in time, I wanted to look for something alternate. And that is how my journey started. And it was interesting that I found a lot of literature, a lot of scientific evidence, which I never saw during my training. And when I applied those and I changed my diet and I changed my lifestyle, which, as you know, when you're doing residency, you're working 80 hours, you really are not exercising, and you're eating all kinds of junk food in the hospital. And the same thing you do when you're a hospitalist, because you have no time. And so that was the turning point for me. And I realized that there's a better way to do this. And I tried it on myself first. I saw the results and I was actually surprised. And since then, I started learning about it and got into functional medicine. I learned about Ayurveda, which actually was my roots to start off with. But I actually abandoned it because, I thought the conventional way was the right way to go. So it was really like coming back home.
Great story. And we are happy to have you now around us and helping more and more patients from the different perspective of medicine. So yeah, great to have you today and talk about a very important topic. And let's start with what is long haul COVID?
So the World Health Organization basically defines long haul COVID as if somebody has either a COVID infection or a suspected COVID infection, and they develop symptoms within 3 months of that infection, and those symptoms last for over 2 months, and there is no alternate diagnosis to explain those symptoms, then that would be termed as long haul COVID. So that is really the definition of long haul COVID.
And how prevalent is that?
Actually, it's very interesting and actually very tragic as well, because when we look at studies done in the outpatient setting, so even if we exclude patients who were actually hospitalized for moderate COVID or who actually went into ICU, even in the milder cases, the numbers are 1 in 3 and 1 in 4 people actually develop long haul COVID symptoms. So it is kind of scary with, as you know, the magnitude of the people who got infected. and who will continue to get infected because we know that we cannot put COVID back into the lab. So we are talking about long-term consequences in a lot of people. And because the diagnosis is itself very complex, because it's not like, if you have a blood sugar level above this cutoff, you're diabetic. It's not like that at all. It's a pretty complicated and sophisticated diagnosis because of the multitude of systems involved. So it is concerning that we are looking at a lot of people coming with this issue.
So let's talk about the symptoms. So what are symptoms of long COVID?
Well, just like the infection of COVID has had so many different systems involvement. Similarly, we are seeing that long haul COVID also has multiple systems involved. The most common being fatigue that we have seen, but we have seen people having digestive tract issues, like they would have nausea, diarrhea, stomach upset. Then we have seen people who have respiratory issues, like they would have shortness of breath, a cough. One of the very prominent systems that has been involved is cardiac. So we are seeing people with palpitations, chest pressure. They would have increased heart rate, particularly on exertion. We are also seeing patients who are having neurological issues, especially parts like symptoms like they would have dizziness on standing. They would actually have lightheadedness. We have seen a lot of mental health issues. We have seen exacerbation and even initiation of anxiety, depression. There has been reports of tremors, been report of different rashes. So really, if you look at the spectrum, it's all over the place. So there is nobody that you can say, well, this is the classic picture. There is no classic picture. And every patient with long haul COVID will have its own set of symptoms. So this has been like pretty wide in terms of its manifestations.
And why do you think one patient develop one set of symptoms and another patient develop different set of symptoms? So why there's so many different people experience differently long COVID?
That's actually $1 million question, because that actually what you are asking really is the root cause, because it is the root cause which is going to determine, where your symptoms are. For example, one of the root cause has been the persistence of the virus or persistence of viral particles. And this is a theory which was basically initiated by Dr. Patterson. And so it's very interesting that what he says is that if there is persistent virus or there are persistent viral particles, then the body continues to be inflamed because it still thinks that somebody is trying to attack it. And because that inflammation can actually literally affect any part of your body, depending on the weakest organ, right? So you will find that if the inflammation is affecting one organ more than the other organ, in one person, that organ could be lungs. In another person, that organ could be pancreas. And so you will see that those two people will have different manifestations. The second theory which has come about is a theory of autoimmunity, that what happens is that when antibodies are released to attack the virus, they ultimately recognize part of that protein on the surface of the body system or organ. And so there's an autoimmune response, and the autoantibodies, we call them now autoantibodies because they were initially produced to attack COVID, but now they are attacking the body. So depending on which organ they are directed towards, the symptoms will be according to that. So there's a second theory, which again explains why different people will have different symptoms, because different organs are being affected in different people because there are different autoantibodies being produced. The third very interesting hypothesis, and actually this was a study that was done, which showed that because we know that one of the most common symptom was fatigue, the study looked at a reactivation of mono. And they found that there were actually over 60% of patients who had a reactivation of mono, indicating that, it was not COVID, but the reactivation of mono, which was causing this problem. So that is the reason why, if there's fatigue, we don't know, is it really the COVID that's causing the fatigue, or is something else that's causing the fatigue? And that also brings us to the fourth root cause that has been identified, which is autonomic dysfunction. So we know that the autoimmune system is made up of the sympathetic, which is the fight and flight, and the parasympathetic, which is the rest and relax system. And remember that sympathetic system affects multiple organs. Literally every single organ has a sympathetic branch and a parasympathetic branch. So when COVID attacks, then it basically causes the body to get into the sympathetic mode. And these patients are not able to get themselves out of the sympathetic mode. And so a lot of symptoms that you see, particularly on the end of cardiac, like, palpitations, exertional dyspnea, without having any underlying cardiac pathology, or dizziness, they are all indicating that the sympathetic activity is in overdrive and the body's ability to shut it down has been impaired. So if a patient has those symptoms, then you have to think about whether there is activation of the sympathetic mode. And the last and most interesting data that we are having is pertaining to the endothelial system. So endothelium is the lining of the blood vessel. And we know that one of the key receptors through which COVID enters the cells is ACE receptor, right? So this receptor is present in many organs, but it is primarily present in the blood vessels. And so what the theory is that, because COVID has affected the ACE receptors, it has basically turned on the process of inflammation of the blood vessels. And so when you are seeing different organs being affected, you're seeing those because those blood vessels are still inflamed. And so depending on where COVID hit, and where those blood vessels got inflamed is where the manifestations of the disease are. So those are all the reasons why, because the underlying causes are so very different. Similarly, the manifestations are quite different depending on what causes and where that cause is being impacted in the body.
It's kind of by individual. So everybody is so different when they come to COVID infection from different, predisposition, and also already having some conditions or comorbid conditions and diseases. So that's why we experience different. I can relate to one of the theories that you mentioned. It's a mononucleosis, right? Epstein-Barr virus, because I had COVID, and after that I was tested for different viruses, and it happened that I have Epstein-Barr virus and also cytomegalovirus. So I think if everybody would be tested for different things, it would be more found that only Epstein-Barr virus. Even though I don't experience or I didn't have long COVID, because my maybe healthier body, I could deal with that. But that was one of the side effects that my body expressed now, all this antibody to the infections, not only one infection, but multiple. So that's very interesting, and we're still doing more and more research on the COVID and how it's affect people. But still, why one person experience long COVID and another person does not? Like, I did not experience, but I know so many people experience long COVID. Why? What's the risk factor for developing long haul COVID?
So one of the risk factors for developing long COVID, and what we have found, the research has looked at, is gender. So we know that women are much more likely, twice as likely to develop long COVID than men. And it's very interesting. This goes directly with the hypotheses of autoimmunity, because we know that women have more autoimmune diseases than men. So that is one of the risk factors, just being women as risk factor. The second risk factor is age. They've also seen that people between the age of 40 and 54 are more likely to develop long COVID. Then they found that people who actually had comorbid conditions, if you already have an underlying disease, which basically means that, your system already is under some degree of inflammation, because most chronic conditions are based on inflammation, or you have an underlying autoimmune disease. Your system is not going to be able to address the virus the way the other systems are going to be, or another individual is going to be. And of course, the fact that if you get hospitalized and have severe COVID, that's directly indicating that the system is completely overwhelmed. So in those individuals, the percentage of people developing long COVID was almost like 50%, which is extremely high. So yes, it has to do with, where you are standing with your health, really.
Mm-hmm. And what's your theory of gender specificity and autoimmune? Why women have more of those diseases like autoimmune disease?
Excellent question. So we know that estrogen has a very important role to play in it. And because we as women have estrogen does predispose us to have more autoimmune issues relative to men. So that is the hypothesis as to why women actually get more auto antibodies relative to men. And it's interesting because you will also see that thyroid diagnosis takes place. Usually the diagnosis of hypothyroidism is around the time when women are pregnant or when they deliver, because that's the time of significant hormonal change. And that is when a lot of these diagnoses are picked up.
And same in menopause, right? Yeah,
absolutely right, 100%.
And also because on this theory, you could say the age. So the more complication after COVID infection is the later age for women. So because our estrogen drop after 40 or getting lower, that's why older women.
Yes, you can definitely argue that that's also the time when you are going to be going through the menopausal area, and that's where hormone imbalances are happening, definitely. And on that end, actually, we have also found that post one of the areas that's affected in long haul COVID in women is their menses. So their periods might become heavier, or they would see irregular periods. So we are really seeing that there are hormonal changes. But one can also argue that one of the reasons why these hormonal changes are happening, in addition to the fact that, that there is a hormonal imbalance going on, is that cortisol, which is a hormone of inflammation, also directly affects progesterone and estrogen. And so there are multiple ways in which, our hormonal system can get disbalanced.
Mm-hmm. Yeah, it's a complicated topic, and you can approach it from different perspectives. So how would we diagnose, or what's the diagnostic criteria for long COVID? If it's so complicated, it's probably difficult to diagnose it.
It is very difficult to diagnose it. And I'll give you an example. Like, we had a patient, she was around 42 years old, and she had COVID. 4 weeks later, she developed some fatigue. And then she started becoming very anxious, never had anxiety before. She started having brain fog. She was getting episodes of dizziness and chest pressure. And, initially she thought there was probably something cardiac going on, because she was so fatigued, and she would have like shortness of breath and stuff. And she was basically in the ER. And they did all the workup. Her troponin was negative. Echo was done. That's negative. They said, there's something going on. We don't know what it is, but right now it's not cardiac. You can go home and follow up with a cardiologist, who did a cardiac MRI, which was completely negative. She went to rheumatologist. They said, well, we can't find anything autoimmune. All her blood work is negative. She was sent to a neurologist because maybe this is an MS issue or something like that. They couldn't find any MS or anything like that. So it was very interesting because she went to almost literally every specialist, and all of them checked, well, we don't know. And so, if you look at her, she had COVID just 1 month ago. And with the barrage of symptoms that she is having, very clearly, this is long haul COVID, but you couldn't have diagnosed it until unless you had checked off all the boxes. Because there is no classic test that you can say, okay, do this test. If this test is positive, we will say that you have COVID. And that is the reason why it's so difficult diagnosis, because you really have to make sure that there's nothing else going on before you term it as long haul COVID.
So is there a diagnostic criteria? Like what the check boxes that you need to go
So the diagnostic criteria is that you have to develop the symptoms within 3 months of having either COVID or suspected COVID. Mm-hmm. And those symptoms have to last for at least 2 months. Mm-hmm. And there should be no other alternate diagnosis to explain those symptoms. Mm-hmm. That is the criteria that has to be met for it to be termed as long haul COVID.
So it's kind of theoretical diagnostic. So there is no lab that can confirm it. All diagnostic that she went through, they were all negative for all organs.
Yes.
It's kind of disease in your brain, like they talk about fibromyalgia. It's like disease of exclusion.
Yes. So what I like about what you have said is you talked about something very clear. Fibromyalgia is one of the most confusing diagnoses that we have in medicine, right? There was actually a paper that was written about the common things between fibromyalgia and long haul COVID, because that is precisely what it is. Because even in fibromyalgia, you talk about inflammation and you talk about, endothelial dysfunction possibly, and there's always this issue about mono. Even in fibromyalgia, there's this question about fatigue and mono reactivation. So yes, there are a lot of things common between fibromyalgia and long haul COVID. You're absolutely right about it. And that's why there was a paper actually written about it to talk about the common things between these two diagnoses. And yes, you can say that it's kind of in the head diagnosis. And that's why some of these patients actually suffer quite a bit before they actually receive the diagnosis, because they're told, well, we can't seem to find anything wrong with you. And they're like, but I'm having so much fatigue. Some of them have actually had to leave jobs, or they're doing part-time because it's very hard for them to continue with all the symptoms that they're experiencing.
Mm-hmm. And we know that fibromyalgia is autoimmune disease. So is a long COVID. Exactly. That's probably similarity of the developing the disease.
Definitely.
Yeah. So if you don't have diagnostic criteria, how do you treat long COVID? What's the approach to treatment of long COVID, particularly, and compare how patients treated in a conventional medicine, and also what's a different your approach from the functional medicine perspective?
So I think this is also the time, when like fibromyalgia, if you talk about fibromyalgia, like there is no treatment for fibromyalgia in conventional medicine, as you know, right? In conventional medicine right now, they do not know what to do with these patients, which is very sad. In functional medicine, because we are not interested in symptomatology, which is like, I'm not interested in trying to reduce the symptoms, because that is really not going to happen unless you know the root cause. So, in functional medicine, the first thing would be to identify what the root cause is, which means that you want to identify if there is really inflammation underlying it. You're looking for monoreactivation. You're looking to see signs of autoimmune dysfunction in terms of looking at the digestive tract, because we know that 90% of your digestive tract is where your immune system is, right? So you want to be able to assess that. You want to be able to look for leaky gut if you're looking at autoimmunity. You're supposed to look at nutritional factors, because if you have inadequate nutrition, your ability to heal, and especially if you have digestive issues, is pretty low, And so basically in the functional approach, you look at the whole spectrum of things which are the root causes. And then depending on that, you will go ahead and address the root cause.
Mm-hmm. So can you give me an example? For example, that person who came to you, who went already to a lot of doctors, how did you help her to detect or also to deal with long COVID?
So what we did for this person is that we first did an assessment, right? When you do an assessment, So the assessment does not start from when you got COVID, because that's too late, right? You have to do an assessment from before that. You look at the assessment all the way from birth till the time they develop COVID, because the primary question is the question you asked. You ask the question that why is it that this person developed long COVID and nobody else did, right? Because that is really the key question that you have to answer. And on the basis of that, you would always get clues. You will know if there was an issue with inflammation before, if there was a digestive tract issue to start off with, if there was a nutritional issue to start off with. So that would give you some clue as to what would have led to this problem. And then on the basis of that, you will say, okay, it seems like we have a few areas which could indicate why this issue is there. And you will go ahead and do an assessment on that. And it's going to be an objective assessment. You did a subjective assessment through history, then you do an objective assessment through testing. And then at the end of it, what you will do, depending on what you have found, like for this woman, one of the things we did was we found that she had major issues with cortisol. Her gut was definitely dysfunctional, which she didn't even recognize, because she said, well, I always have some loose bowels here and there, which was very interesting, that this is how a lot of us live our lives. And we think it's normal because we've had it forever. And so we saw that she had leaky gut. And we went on to resolve that. Then it was interesting. She had mono reactivation, although she denied a history of mono. So we actually started her on high dose intravenous vitamin C, because that is the way you turn the immune system around. That's also how you deal with the adrenals. And so, she actually was doing very well after, in about 6 weeks or so, she actually had stopped her job because she really couldn't function. And so then she restarted her job in about 6 weeks. And the other thing that happened was, because she was relatively healthy, it was hard for her to believe that she has gotten into this situation. And she became very anxious, because every time she would walk, she would have shortness of breath. And now she was like, I don't know how I'm going to function. So she had so much anxiety about, what's going to happen to her and her life and her kids. So and then the anxiety, which was happening because of the symptoms, was exacerbated by the inflammation that was going on. And it was very interesting that at the time when I talked to her, what I realized was that the infection had actually triggered the trauma that she had as a child. So it was almost like she was having PTSD, but now the trigger was different. And, when you have another trauma, then the previous trauma can actually come to the forefront of losing somebody that you had lost, and now you're going to lose something else in your life. So we also looked into something called microcurrent neurofeedback to kind of help her with that, because, when you don't deal with something that's in your background, at some point it comes to haunt you. So you have to address it, whether you like it or you don't like it, at some point in your life. And so it was really nice to see how she came around and how she was able to recover. But the process, took some time. Mm-hmm. And she came to us after about, I think, 6 months of her having these symptoms, because obviously she first started with the conventional to see if she could find anything, and she couldn't find anything. And then she came to us. So she came after about 6 months, which I think is another issue, because the later you start, the damage continues and continues and continues. And so, that's another problem. So then it will take longer. Whereas if you come immediately, then something can be done before the process continues.
Mm-hmm. So how long can long COVID last?
Actually, that is a very important question, because what we are seeing, there was a study which showed that about 30% of patients with long haul COVID actually continue to have symptoms even post 9 months. So it can be pretty long. And some of these patients, they notice improvement, but that is extremely slow. And part of the reason is because there is very little knowledge about the fact that there are underlying factors that can be reversed. If you're sitting there hoping it would improve, then it's kind of tough.
Mhm. So it seems like there is a multiple layers to the problem, and we need to address, depends on the individual, of course. And um, we use not only food, not only lifestyle approach, but also maybe supplementation, and also symptomatic parasympathetic, sympathetic parasympathetic system balance, right? So we have a psychological and mental and physical, so on all different levels, because you cannot treat something just on a physiological level, as we know, as a holistic practitioners.
Absolutely.
So yeah, there is a lot that we need to think as a practitioners to help those patients, and patient needs to know that it's not only one thing that they're gonna help, that's gonna help them.
Absolutely. I completely agree that, the beginning is the food, right? I mean, food is medicine. I mean, nobody can, even if they're giving you supplement, they cannot fill your plate with supplements, So of course, the diet is the key. The lifestyle is the key. What you're exposing yourself is the key. Are you causing more inflammation with how you're living your life is the key. And supplementation is definitely there, no question about it. So and like you said, it's not one thing. And this is the other place where conventional medicine and functional medicine differ, because you're used to one medication for blood pressure, one for blood sugar. And so, when they come, they're like, what one supplement do you want me to use? And you often have to tell them it's not one supplement that's doing it. This is not a magic pill. It's a combination of what you eat and the nutrients that your body needs and the other things that you need, which may not necessarily happen through supplementation. Like, for example, if you're using microgranular feedback or using intravenous therapy, and everybody is at a different stage. Not everybody needs everything, but it's usually a multitude of things which have to come together. Because the breakdown, if a body is completely breaking down, then it's not a single organ that needs revival. And that will take time, and that will need a multi-pronged approach. So yes, you're absolutely right that it's not one thing, and you can't just say, just give me this and I'm going to be better. No, it's not going to be like that.
And talking about the timeline and also how long is the COVID, and I think the earlier you address the problem, the better, because just to think about, just to having COVID, it's already stress. And whatever stressful life you had before you got COVID, it's all a combination of everything. And if your body's overwhelmed, it cannot handle everything that's happening with the infection or with the stress about infection. And if you don't have a good base already with food and exercise and sleep and so on, it's very hard to the body deal with that. So that's why you need help of other practitioners, doctors who help you with that, because it's gonna take long time if you are not doing anything about it. Maybe your body can overcome it, but maybe not. And we don't know. We have only 2 years in this situation. So we don't know how long it can last if you don't do anything about it. And it can damage further and further different organs and systems.
Correct. You are actually talking about, there is actually a term that was coined, and you've just hit the nail on the head when you said that. It's the term is immune aging. So the age of your immune system may not necessarily be your physiological age. So you could be 24 years old with an immune age of 62 because of all the stress that you are under, what you're eating, how you are living a life, And so you're absolutely right that, the earlier the better, because if you're not going to address the problem, and we talk about long haul COVID as a problem, but there is more to the story than that, because what we now know about COVID is that for up to 1 year post COVID, our risk for getting heart disease and stroke increases significantly. And it increases even in those people who are less than 65, who are non-smokers, who are non-diabetics, which is very interesting. That even if you don't have those risk factors, even then your chance of heart disease and your chance of stroke increase. And not only that, there is an increased risk of developing diabetes. There is an increased risk of developing kidney disease. So, I mean, the idea of waiting is like, you are a ticking time bomb and you're like waiting to see if it kind of shuts itself off or does it explode. So why would you want to do that? So I completely agree with you that, that's your body telling you that it's on the verge of a breakdown, and you do something about it sooner rather than if something major happens.
So you talk about other complication after COVID infection besides long COVID. So it's a heart problem. What other complications after having a COVID infection? So besides long COVID, and you said heart problem, right? What else?
So you can have so basically we have seen people develop heart attacks. And the risk is increased for at least 1 year. In one of the studies, the risk was as high as 72% increased risk, even if you don't have other risk factors for heart disease. They looked at stroke and they found there was an increased risk of stroke, and the increased risk was about 52%. Again, even if you don't have any of the risk factors for stroke, and that risk continues for up to 1 year. There's also the data about around 40% increased risk of developing diabetes. And it's not just type 2 diabetes, it's also type 1 diabetes. And both of these were like type 1 and type 2 diabetes actually increased even in pediatric populations, which was very interesting. And these people with the new onset of diabetes after COVID presented with complications of diabetes like diabetic ketoacidosis. And so it's interesting that the virus, we now know, can directly damage the pancreas, leading to this complication. Or there's an indirect target, which is when the stress related to the infection causes increased blood sugar and insulin resistance. So there are multiple hypotheses now as to why there is such an increased risk. So that is the second issue. That's actually the third issue with COVID. And then there is kidney disease, which is very interesting because now we know that they looked at a group of 100 people who had COVID, and they found that within 1 month of the disease, 5% of them had 30% reduction in their GFR, which is kidney function. And they found that 30% there is increased risk of acute kidney injury related to COVID infection. And they found over 200% increase in the development of end-stage kidney disease, which is terminal kidney disease, where you require dialysis. And this was particularly seen in people who actually were in the ICU and people who had kidney injury as a result of COVID went on to have this problem. And then they have also come up with another complication secondary to COVID, which is called GBS, Guillain-Barré syndrome, which is a condition in which you develop autoantibodies against your own nervous system. And so the patient starts experiencing weakness and numbness in the lower extremities or legs, and then it progresses upwards and the patient is completely paralyzed. This is considered a medical emergency, but this is another complication that we have identified related to COVID. So these are serious issues, and so if you don't address the problem early on, we don't know what the next thing is going to be.
It seems like those complications are related to direct damage from the virus, like ACE receptors and tissue damage, or autoimmune related complications.
Correct.
Yeah.
So they're both.
Yeah. So how do we prevent or minimize those complications after COVID infection?
So it's very interesting. There was a study that was published last year. It was a study in which they took a look at moderate COVID patients. So patients who had moderate infection from COVID, they were actually in the hospital, but they were not on vent and they were not in the ICU. And what they did was very interesting. They actually started them on high dose IV vitamin C for a week, actually in the hospital. And what they found was that the number of people who were given the high dose IV vitamin C, the percentage of them that entered the ICU was much lower. They found that these patients who were given IV vitamin C had lower CRP levels, which is a marker of inflammation. And remember that one of the complications of COVID is development of clotting. And the clots that we have kind of seen in people, whether it be in the brain or in the lungs, they found that people who were given IV vitamin C, those patients had less clotting issues. And one of the most important predictors of severe COVID is to not have adequate numbers of lymphocytes, which are the fighter cells, a condition known as lymphopenia. They found that patients who were given high dose IV vitamin C, they actually did not have low lymphocytes, which they thought was probably the reason why they did not end up in ICU. And so basically what they did, and if you were to look at it conceptually what they did was they started working on the immune system of these individuals, right? And so really, is COVID the problem, or is it really the immune system the problem? Like you said that you also had COVID, but you never developed an issue. And the reason was because you had a very robust immune system. And so I often tell people that, before you have an infection, if you feel that you are somebody who may not have the most robust immune system, either because you have an underlying disease, like you're either over 65 or you have an autoimmune disease, then you need to basically, find out what would be a good immune boosting regimen for you. And so in functional medicine, we actually address that by understanding what are the factors which are impacting your immune system and kind of give you something which would help you give you a robust immune system. The second thing is, let's suppose you didn't do that. We are all humans, we all make mistakes, right? And you get COVID. Most people wait till they're very, very severely ill. And I often tell them, you can't do that. The moment you have it, do something about it. Don't wait till the very end. Because even then, like the study looked at moderate, right? And there was actually another study which looked at patients who were severely ill in the ICU. When they were given IV vitamin C, they didn't see a benefit because it was too late. So if you want to do the intervention, then do it right away. And the intervention is going to be to strengthen your immune system and to make sure that you are able to fight the infection. So that is really the prevention aspect of it, that you need to work on your nutrition, because nutrition is the key. You need to work on your lifestyle, which is the key. And then you have to know that we all have our weak points. I'm sure we all have areas that we need to strengthen, the areas where we know we need some support. So give it the support that you need, and you will be able to prevent from going into severe COVID. Having COVID infection is not a problem. If you have a mild infection, it's actually in your best interest, right? Because you get natural immunity, and we know that natural immunity is better than the immunity from a vaccine. So having a COVID infection is not the problem. The problem only is going to happen if you don't have a robust immune system and then you get COVID. Now you're in trouble, because now you will get into a severe situation, and then you are going to end up with long haul COVID, because we know the chances are much higher if you get severe COVID. So I think that is the way to prevent it, to really work on the immune end of things.
Mm-hmm. It's interesting that your approach as a functional medicine doctor is completely different from approach of allopathic or conventional medicine. I went on particular research how to treat COVID. All research articles, not research article, but everything, all information that is on CDC, on information that related to conventional medicine doctor, there is no treatment until you need to go to the hospital. So there's just a symptomatic aspirin and cough medicine and so on. But we know the earlier you start to address the inflammation and infection, that's when you have the best result. So unfortunately, our conventional system, medical system, does not work the way we want it works. So that's why we have functional medicine, and we have doctors who have different approach to treating COVID, and that's how we prevent complications from COVID. So I'm grateful to have you in our circle and know where to refer patients who have COVID symptoms. So what would be your recommendation to someone who's experienced symptoms of long COVID?
So the first thing I would tell them is that, if you're experiencing, like I said, the COVID, long haul COVID is a diagnosis of exclusion, right? You have to exclude everything, right? So the first thing I would say that whatever your symptoms are, you need to have an assessment. You can have a conventional assessment, and that's perfectly fine, because you want to make sure that there isn't anything else that's going on that is being deemed as long haul COVID. So the first thing is to make sure there isn't anything else going on. And once you know that it's there's nothing else going on, you have a history of COVID or suspected COVID, that is when I would tell you that your best bet is going to be to go to a functional physician who can actually look at your symptoms and look at your history and understand why did you get in the position of developing long haul COVID? What are the current reasons why that is still happening in your system? And what kind of changes you need to make to your life, your diet, and what kind of supplements you need, what kind of support you need to get the immune system back into balance. That is your best bet.
Yeah, great advice. And actually, vitamin C helped me with my COVID. I increased my dose and the whole lifestyle and everything else. So everything works, but not one thing. You need to do multiple things. Correct. To help yourself, and particularly find somebody who can help you to navigate with all these complicated conditions.